over again. So, death, destruction, and the unthinkable are routine things that firefighters and EMTs see every day. Every single day, men and women across the country respond to an unimaginable amount of emergencies. My name is Nick Wozniak. I was a firefighter EMT from 2010 until I was hurt on the job in October of 2016. I worked a minimum of 48 hours a week and sometimes worked over 100 hours a week in pretty busy areas too. What happens when a firefighter or an EMT is not available though? Are you ready to step up to the plate? At some point in your life, you may possibly, if not probably, have the opportunity to change someone's life forever. What you do in those moments will stick with you for the rest of your life. One of the most critical things that firefighters and EMTs respond to is a CPR. How effectively CPR is performed, such as the depth and speed at which you do chest compressions, can mean the difference between a celebration or a family planning a funeral. It's the last chance that person has to live another moment. In the next several minutes, I'm going to explain to you how to do CPR. Is everybody ready? All right. Just a disclaimer before I begin. This isn't a certification class. I'm just telling you how I was taught in my certification class. So don't go out there and say, Nick said this, all that. All right. So if you find someone unresponsive, the first thing you should try to do is arouse them. You can do this by rubbing their sternum. Don't be worried. Rub their sternum to see if you can arouse them. If that doesn't work, you can try yelling. Try to wake them up somehow. If that doesn't work and the person's not breathing, check their pulse. You take 2 fingers and put it just to the side of where the Adam's apple is on a male. If there's no pulse and you're by yourself, yell out for help. If somebody's with you, have them activate 911 when you begin chest compressions. If the victim is not in a supine position, which is lying flat on their back, you first have to put them in that position to do the CPR. Begin chest compressions, you place one hand on top of the other. You lock the fingers from the top hand into the fingers on the bottom hand so they don't slip. You then place the palm on the victim's chest right in between their nipples. You begin chest compressions by pressing down 2 inches into their chest. You do it at a rate of 100 beats per minute. This might sound morbid, but it's pretty much the same speed as the tempo from Another One Bites the Dust by Queen. You can use Staying Alive by the Bee Gees, but I really like Freddie Mercury, so I go with Queen. It's important that you keep your elbows locked out. You don't want to bend your elbows while you're doing CPR. You lock them out and you do CPR with your entire upper body, not just your arms. It gives you a lot more leverage and you perform better CPR. It's completely normal to feel the victim's ribs breaking and the cartilage popping. You're going to hear it, you're going to feel it, and the first time I did CPR, I got nauseous like you wouldn't believe. It's fine. You got to work through it. If you stop for even a minute, it can mean the difference between successful CPR and that funeral we talked about. I know some of you are thinking, aren't we supposed to breathe for them? If you don't have the proper oxygen supplies, no, you don't. The human body stores enough oxygen in its blood that if you're doing chest compressions, it'll circulate it for about 5 minutes and effectively keep things active like the brain. You won't have as much brain damage. Circulation should be your #1 concern, except for personal safety. You got to look out for yourself first. If you see somebody lying in the middle of a busy street and you think they're in cardiac arrest, don't run out there and try to help them. You got to look out for yourself first, because then you're going to be in CPR mode and somebody has to do it on you. We don't want that. If you've been by yourself this whole time you've been doing CPR, you stop chest compressions after you perform them for a couple minutes. Call 911, put your phone on speaker, set it next to you, and then get right back to chest compressions. Very important. You don't want that much lag time. Every 2 minutes after you get back to chest compressions, stop, check for the pulse again, and if they regain the pulse, don't do chest compressions anymore. They're good for the time being. It is crucial, though, that you ensure their airway is open. If their head is tucked into their chest when they're lying flat on their back, you have to tilt their head back and you push the back of their jaw towards the ceiling, and it straightens out their airway. and then when they start breathing on their own, the oxygen starts circulating again, and it decreases the amount of brain damage that you can have. After what seems like an eternity goes by, which realistically was probably only a couple minutes, the fire department should be getting there, paramedics and EMTs. To put it bluntly, get out of their way and answer any question they have. They don't mean to be mean, but they have a job to do too. Whether the victim survives or ultimately passes away, if you follow these rules and do CPR like that, you can sleep good at night knowing you did the best you could. Thank you.